This is Jody Siegel at Johns Hopkins University. I'm going to tell you what is comparative effectiveness research. In this very brief video, I aim to define comparative effectiveness research, explain how it came to be, and how it has become rather synonymous with patient-centered outcomes research. I have no financial conflict of interest, and the views expressed are my own. Here is the definition of comparative effectiveness research that was set out by the Institute of Medicine in 2009. The expert panel said that comparative effectiveness research is the generation and synthesis of evidence that compares the benefits and harms of alternative methods to prevent, diagnose, treat, and monitor a clinical condition, or to improve the delivery of care. The purpose of comparative effectiveness research is to assist consumers, clinicians, purchasers, and policymakers to make informed decisions that will improve health care at both the individual and population levels. Included in this definition is the notion that something is being compared and that the information is to be used for decision making. This is not basic science to generate new knowledge about mechanisms. This is knowledge for decision making. There were two big forces which led to the prominence of comparative effectiveness research. One was the drive to deliver clinical care based on evidence rather than upon expert opinion or tradition. This mindset came to prominence in the 1980s and led to the development of the U.S. Preventative Services Task Force in 1984 and the Cochrane Collaboration in 1993. This was soon followed by the Evidence-Based Practice Centers of the Agency for Healthcare Research and Quality in 1998. Paralleling this work was the work of John Wenberg and Elliot Fisher and others on small area variations in spending and outcomes without clear relationships between the two. This led others to conclude that it should be possible to improve the effectiveness of care while containing costs. This drive for evidence and the drive for cost containment, among other things, led to this report from the Congressional Budget Office in 2007. This report, called the Research on the Comparative Effectiveness of Medical Treatments, advocated for research on the comparative effectiveness of medical treatments. The premise being that it is possible to constrain healthcare costs, both in the public programs and in the rest of the health system, without adverse health consequences. And perhaps the most compelling evidence, as stated in this report, was the substantial geographic differences in spending on healthcare, which do not translate into higher life expectancy or measured improvement in other health statistics in higher spending regions. Hard evidence is often unavailable about which treatments work best for which patients and whether the added benefits of more effective but more expensive services are sufficient to warrant their added expense. Therefore, the goal of comparative effectiveness research is to generate better information about the risks and benefits and costs of different treatment options, which could eventually alter the way in which medicine is practiced and yield lower healthcare spending without having adverse effects on health. The Recovery Act of 2009 had a surprising and powerful effect on comparative effectiveness research. How? By powering $1.1 billion into this type of research. This was soon followed by the Patient Protection and Affordable Care Act, the Health Reform Act of 2010. And this included a section specifically entitled Patient-Centered Outcomes Research, Section 6301. And in this legislation, there's the statement that the terms comparative clinical effectiveness research and research mean research evaluating and comparing health outcomes and the clinical effectiveness, risks, and benefits of two or more medical treatments. Also included in Section 6301 was the establishment of PCORI, the Patient-Centered Outcomes Research Institute. So importantly, this is not an agency of the government, and the mission of this organization is to assist patients, clinicians, purchasers, and policymakers in making informed health decisions by advancing the quality and relevance of evidence concerning the manner in which diseases can effectively and appropriately be prevented, diagnosed, and treated through research and evidence synthesis and the dissemination of research findings. So this sounds very much like comparative effectiveness research with a name change, and indeed it is. Subsequently, the Methods Committee of the Patient-Centered Outcomes Research was tasked with generating a definition of patient-centered outcomes research. The definition which they produced was that patient-centered outcomes research helps people and their caregivers communicate and make informed healthcare decisions, allowing their voices to be heard in assessing the value of healthcare options. This research answers patient-centered questions such as, given my personal characteristics, conditions, and preferences, what should I expect will happen to me? These might be questions of prognosis, perhaps. What are my options, and what are the potential benefits and harms of these options? Those sound more like traditional comparative effectiveness questions. What can I do to improve the outcomes that are most important to me? That might be questions about self-care or screening, prevention of disease. And how can clinicians and the care delivery systems they work in help me make the best decisions about health and health care? To many, patient-centered outcomes research is a subset of comparative effectiveness research. In summary, comparative effectiveness research, or patient-centered outcomes research, answers questions that stakeholders or decision makers need to have answered to make decisions about interventions. This type of research uses the tools of systematic review and evidence synthesis. It uses observational studies for evaluating effectiveness and safety, also pragmatic clinical trials that are trials which are conducted in a usual care setting, modeling techniques, as well as implementation research to learn the best way to implement findings of research. Thank you for joining me today.